Hello, everybody. Welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jagos. Today, I'll be doing the second part of observations on the three current methods of treatment. Well, so we go to the second point, that is treatment of the symptoms. So in the first part, we have seen the treatment of the name of the disease. So the second point is treatment of the symptoms. It deals with general indications, general remedies, and routine remedies. So in short, in a nutshell, treatment of symptoms, it will deal with just general indications or general remedies or routine remedies which are used. The diseases at that time were given vague names, and it was impossible to find out a suitable remedy to combat it. So as you all know, the old school of medicine always gave the different names to different diseases, and they found a corresponding remedy according to the name of the disease. As I told you in the first part, this sort of practice would be done, and it would be quite useless as it never used to cure the disease. The intensity of the disease used to increase, the symptoms used to increase, artificial diseases were created, and complications occurred also in the disease. So therefore, symptoms of disease which were dissimilar were separated. The similarities of many of them were investigated. Those that were considered to be connected with united in classes, order, and species, and those having similarity of exciting cause and functions, included the location, and some common symptoms were classified, and they were treated with general remedies having different names: astringent, antiseptic, sedatives, tonics, antispasmodic, purgatives, diuretics, and diphoretics. So the symptoms of the disease which were dissimilar, they were separated, and the similarities of many of them were investigated. And those that were considered to be connected were either united in a class, order, or species. So according to the similarities, the medicines were classified into a class, order, or species. Those having similarity of exciting cause and functions, included the location, and some common symptoms were also classified. So those remedies which were having similarity of exciting cause, or rather those diseases which were having similarity of exciting cause and functions, they were noted with the common symptoms also classified. And therefore, with this sort of classification, different names were given, like astringent, antiseptics, sedatives, tonics, antispasmodic, purgatives, diuretics, and diphoretics. Diphoretics is what? Which produces more perspiration. Thus, there was confusion whether to treat disease with their peculiar name or to treat it with the name of a particular symptom. So now there was a confusion whether you treat the disease with their name or you treat the disease because it has a particular symptoms. However, the treatment with general remedies was gaining popularity amongst the learned physicians at that time. So the orthodox school of medicine, which was quite popular amongst all the other different systems of medicines, they used to have the treatment or give the treatment of different diseases by the name of the disease. So general remedies were used. By doing so, they were just deceiving themselves and the poor patient has to bear the brunt of the erroneous treatment. So they thought that they were doing correctly, they were treating the patient rationally and judiciously, but however, they were just deceiving themselves because they never used to cure the patient and the patient used to get worse, and the treatment was definitely of an erroneous type. Health was not being restored because the condition only worsened. Or there was some time in which the patient felt better for a few days, and again the symptoms used to reoccur. Example, opium was administered for cough and pain in the chest. So for cough and pain in the chest, they used to administer opium. It initially soothed the presenting complaint. So initially what happened? the presenting complaint of cough and pain in the chest were subsided, or it was soothed, or the patient felt better. After 16 hours, however, the painful cough increased to a still more frightful extent and produced a stupefied sleep with it. So initially, the patient felt better, but Dr. Hahnemann says after 16 hours, the painful cough increased so much so that it caused a stupefied sleep with it. Stupefied sleep meaning what? A deep sleep difficult to arouse the patient. The patient was not refreshed. His sleeplessness and anxiety became all the more greater. And later on, what happened? The patient was not refreshed and the sleeplessness increased and the anxiety became much more and more. The physician did not take care of this. He increased the dose of his palliative. The patient was made worse and death would also ensue. So the physician did not take care of this, of the result of the treatment. But what they used to do, they used to increase the dose of opium and again administer it to the patient. So by doing so, the patient had a decline, the symptoms went on getting worse, and ultimately death ensued. Another example is about a case of dropsy, where diuretic was given and the flow of urine was instant. So another case of dropsy, whereby a diuretic was given and the flow of urine was restored. Or instantly, the patient started to urinate and the dropsy became less. Later on, the urine flow diminished to a great extent. So initially, the patient was better for some time, and again he got worse. So what happened? The flow of urine initially was, the dropsy started reducing, but later on, the flow of urine diminished and the dropsy started increasing. Symptoms of atonic inflammation and mortification ensued. Anorexia, debility, and restlessness increased with the swelling. So what happened when the flow of urine became less? The patient became anorexic, he became more weak and more restless, and the dropsy or the swelling increased. He allowed the patient to die quietly after having shown that he has the power of causing a flow of urine for some days. So ultimately what happened? The patient used to die, but he used to convince the patient or convince the patient's relatives by saying that he had done his best, he has given the best medicine, the flow of urine was restored, but unfortunately, the patient had died. Thousandfold experience would teach him, if he would but let himself be taught, that in dropsy, he only requires to remove the morbid disposition in order to see the water disappear. So, Dr. Hahnemann says that a thousandfold experience would teach him that if you only have to correct the disposition of the patient. Once you correct the disposition of the patient, automatically the dropsy would disappear. But since the old school of medicine had an materialistic view, they did not take this into consideration. They only, whatever the name of the disease was there, accordingly they gave a remedy, and they thought they were doing a very rational way of prescribing. Thus, this can be achieved by the proper remedy for the disease upon which the kind of dropsy depended. So how do you find the disposition? The disposition is nothing but the mental and the physical makeup of the patient, or that is the nothing but the totality of symptom on the mental plane as well as on the physical plane. So this disposition can only be observed, or a remedy can be, a suitable remedy can be obtained by this, by identifying the proper disposition of the patient and giving the remedy. And by doing so, what will happen? The dropsy will completely disappear. So he again reminds us, again in the case of cough with pain in the chest, no pain can be removed permanently and advantageous to the patient except by remedy that affords relief to the fundamental disease. So also in the case of cough with pain in the chest, you have to find out the proper disposition of the patient and then only administer a simple single remedy, and the cough and the pain in the chest would totally disappear. Opium will only act when it is a true remedy for the disease on which it depends upon. So Dr. Hahnemann again reminds us that just by giving opium haphazardly without any rationality, that will not work. So he said that opium will only act when it is a true remedy for the disease on which it depends on. So if the symptoms are similar to that of opium, according to symptom similarity, according to the totality of the symptoms, you give the medicine of opium and then only it will work. But haphazardly, if we just give it, then it doesn't work. Opium is often the best remedy in disease, most free from pain, and attended with greatest amount of stupor, that is unnatural deep sleep. So the guiding symptoms of opium are what? That free from pain or painlessness is a characteristic of opium. And also great amount of sleep. The learned physician is proud of his powers of palliating and of being able to allay pains for a few hours. So the learned physician of the old school of medicine, they used to give opium and they thought they were palliating the disease by allaying the pain for a few hours, or the pain subsides for a few hours. But again, what happens? The pain increases. The after effects of opium is of no consequence to the physician. But whatever after effects of opium are there, the physician doesn't take that into consideration, and ultimately the patient dies. The general remedies do not perform the effects they desire. So whatever general remedies you give, according to the name of the disease, they do not perform the effect desired. The antiphlogistic remedies often actually increase the inflammation, tonics increase the weakness. Thus, general remedies were of no good. So if you give general remedies just on a hearsay, just on the name of the disease, you give a remedy, that will not work, or that will be of no use at all. The complete case has to be taken in detail, and one single simple remedy based on totality of symptom is to be administered in order to cure the sick. So what you have to take into account, the holistic view, you have to take into account the symptoms on the mental level, on the physical level, and then only prescribe. So in short, you have to take the totality of the symptoms. So that's all in this part 3. We will see the next point in the next part. Thank you.